All right, we are live, and I'm excited about today's episode. We're going to talk about what kind of cost per patient you should be looking for. This is a Facebook question that came in recently, and as always, if you're trying to grow, if you are growing, or if you help people grow in the dental industry, just comment below. It's a small community. I know a lot of people. You're scrolling by, you're watching this, and you're in the dental industry. Won't hurt you. Just stop, leave a comment, let me know. A lot of people are going to see this video. Get your name out there, helps me get my name out there. Everybody wins. So I would love for you to comment below. And I have a question for you. Do you track your cost per patient or ROI? So stay tuned for this episode. This is going to be a really good one. Welcome back to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want, but you can't grow if you're overpaying to drive a patient through the door. This question actually came in via Facebook, and here was the question. It said, what do you consider a good price per patient for marketing? What good marketing plans have you had, and what other ways for you to find new patients? I'm evaluating our current marketing and would love some ideas and help that you would expect from a marketing company regarding ROI. So there's a lot baked in there. So there's cost per patient, and then there's ROI, those are two totally different things. So today we're going to tackle the cost per patient side. Maybe if people like this, we'll tackle the ROI side. So let's first tackle the cost per patient. So what does that mean? The cost per patient, or CAC, is the cost to acquire a paying customer that walks through your door. Okay? And so these are only driven from marketing. So as an example, I'm just going to use round numbers to make the math simple. Say you have a marketing budget of $2,500 and you have 25 new patients coming in. What you need to do every single month, $2,500 a month, 25 patients coming through the door. What you need to do is first you take and this is where everybody gets the math wrong right off the bat. First, you take your 25 new patients, and you have to figure out which of those were generated from your marketing efforts. Okay, usually a healthy office has somewhere around 50%, give or take 10% either side, patient referrals. So around 50%. So if you have 25 new patients, 12 of those are going to be from marketing efforts, roughly about 12 of them. 13 of those are going to be from patient referrals. Make sense? Okay, so $2,500 now divided by 12 is what? $200 cost per patient, rough. I'm using napkin math here. So your $200 cost per patient in that scenario. What a lot of people do is they take their $2,500 and they divide it by their total new patients, and that's going to give you a cost to acquire a patient at $100, and that's wrong. Because and people go, well, why is that wrong? Why is that the wrong way to do it? Because marketing is only influencing marketing new patients. And even if you double your budget, it's not going to be $100 per patient, because just because you double your marketing budget doesn't mean your patient referrals are going to go up right away. Patient referrals won't go up until months and months later, 3 to 6 months, because you have to get the marketing patients in, you have to wow them, and then they'll start to refer their friends. But that takes a long time for that to happen, right? That whole buying cycle. So when you increase your marketing budget, only your marketing patients are going to go up, not your patient referrals. Your patient referrals are influenced by your internal operational systems. So if you want to influence those numbers up, you have to change your patient journey and how you're treating the patients. And then you have to make it financially advantageous for your team to ask for them and those kind of things, right? There's ways to manipulate those numbers up or help those numbers go up as well, but there's a roof on it. It can only grow so fast. Marketing, usually you can get exponential growth from marketing, okay? All right, so now that we understand that, so that's how you do the math on it. Now, what is a good cost to acquire a patient? Well, it depends. And the reason that it depends is CAC is a shared number. What do I mean by that? So leads is a marketing owned number. Okay. So what I mean by that is marketing can own the cost per lead or cost per qualified lead, because they are the ones independently influencing that number. So and again, I'm just going to use round numbers. Say you get 50 leads a month, you're spending $5,000. that is $100 cost per qualified lead. And that is solely influenced by marketing. Your office doesn't really dictate a lot of that. Sure, you might say, okay, Google reviews or location and those kind of things can influence it. But at the end of the day, marketing is owning that number. Another number that's solely owned is your case acceptance rate, right? So, and this is all going to make sense in a minute, I promise. Just hang with me. So if you have 20 patients come in the door and 10 of them accept treatment, you have a 50% case acceptance rate. Makes sense? And that's solely owned by the office. It's not owned by marketing. Now, can marketing help influence? Sure. Again, just like the Google reviews and the location influences your leads, the quality of leads or the type of patients that marketing's driving does influence that number, but it's solely owned by the treatment coordinator. Now, CAC, or the cost to acquire a patient through the door, is a shared number because it's influenced by marketing, the number of leads that you drive. It's influenced by shared number because the number of people driving in is owned by marketing, but then how many of your calls did you answer, right? That's going to influence that number. How you answered those questions of the patient is going to influence that. How far out you push that patient is going to influence that number, both in when the patient shows up. As an example, we're in January right now, and if you schedule all of your patients from January 10th forward into February, well, that means all your CAC for January is really influenced by December. Does that make sense? So you actually have to you can only really reactively look at this number. You can't proactively look at this number, right? So I hope that makes sense. And then, so how far you schedule them out, and the no-shows influence that number. Because if you put everybody a year out, you're going to have huge no-show rates, right? Put everybody same day, you're going to have less no-show. And all of that is co-owned, right? So you're co-owning this number. So my question always when people ask, and I'm going to give you an answer at the end, don't worry. I'm not dodging the question. But my question always to people when they're like, well, what's my cost to acquire a patient? Well, your market influences it. Your marketing company influences it. Why does your market influence it? Competition. So your market influences it, your marketing influences it, and then, so how competitive is it? And then you move inside, what's your unanswered call rate? If you're like, well, it's 50%, well, then your CAC's going to be super high. If it's 10%, then your CAC's going to be much lower. And then what is your phone conversion or on the qualified leads just for marketing patients? Are you at industry average, which is 50%? Or are you really good? You're at 80%. That's going to influence it. And then what is your average time to appointment for those patients? Is it industry average 2 to 3 weeks? Or are you crushing it and you're getting them in same day? So those numbers all influence what your cost per patient is going to be. So now let's just go through those, and then I'll give you some real numbers, okay? So let's say you are in a market where it's medium competition. You have a really good marketing team. You have a below 10% missed call rate. You have an 80 to 90% conversion rate, and you're scheduling people same day to get them in, then your CAC, or your cost to acquire a patient, is going to be low. You can get it down really low. You can get it down into the 200s. You can get it down into even 150s I've seen before. Not promising that. I'm just saying if everything aligns like that. Now, how many people do I see that actually has all those things? Very few. Very, very few. I can count them on one hand, and I see hundreds and hundreds of practices, and I talk to thousands of practices. So very few offices have that. Now, what if you don't have all of those things? What if you just have some of those things? Then you're probably going to be in that like 300 range. Then if you're struggling, you're going to be in that $400, $500, $600 range. Now, sometimes that doesn't matter though. And let me explain this, and this is where the nuance comes. Sometimes it doesn't matter if your CAC's $500 if your ROI is good. What do I mean by that? Well, if I was just pulling averages of all of our clients and the average that they're collecting from new patients over a 12-month period for last year, and you're looking at, $1,500. Well, if your CAC is $400, you're doing all right, right? Because you're making that all back in multiples. So if you're making $2,000, $3,000 per patient per year and you're paying $500, you're in great shape. So keep doing that. And then try to do little things to help you bring down that $500. And it's not usually changing your marketing. It's usually adjusting your operations, if that makes sense. Okay, so in the next episode, what we're going to talk about is now ROI. Because ROI is really going to dictate if your CAC is good or not. Because if you have a $200 cost per CAC, but your ROI is over a year is only $400, it doesn't work. So it's like, oh, I have this great CAC. I got to $100 cost to acquire a customer. Cost to acquire a patient, $100. But I'm only making $200 over a year from them. The math doesn't math on that. So CAC is only as good as your ROI. Okay, and so that's the next nuance conversation that we're going to be having. So next week, Monday, oh man, I'm actually going to be flying all day Monday, so maybe I'll do it on the plane, or do it right before I hop on the plane. So we'll test that out. But next week we're going to have this ROI conversation, and drop your comments below if you are trying to grow your office, if you are growing your office, or if you work with somebody or you work with people who are trying to grow their offices. Comment below. I'd love to hear from you. Do you track your cost per patient or your ROI? Thanks for tuning in. We'll see you tomorrow.